I think we will go ahead and get started in the interest of time. I feel like I'm going to be saying that a lot over the next few days. But if that's okay with you, let's go ahead and get started, everyone. So good afternoon, or maybe it is still morning time wherever you are joining us from. But welcome to the Center of Excellence for Infant and Early Childhood Mental Health Consultations Conference, Equity from the Start. My name is Lauren Rabinowitz. I will serve as your session facilitator today, and I am joined by Malkeisha Knight. She will serve as our technology host. As you just saw a quick pop-up, this session is being recorded. Transcription is available through the Zoom platform. If you have any questions, please go ahead and put your questions in the chat. Malkeisha and I will be closely watching for anything that pops up. We also want to let you know before we begin that the views, policies, and opinions that are expressed in this presentation are those of the authors and do not necessarily reflect those of SAMHSA or HHS, Health and Human Services. So that's the quick disclaimer that we need to say before we get started. And so with that, I am really delighted to pass the virtual microphone over to your fantastic presenters today. I've heard different pieces of this presentation a few different times over the last several years, and I always learn something new. So I am really excited that you all have chosen to attend this session. So I'm going to turn it over to Angie Gibbs and Misty Cole. Thank you both so much.
Thank you, Lauren, and thank you, Malkeisha. Misty and I are just really pleased to be able to come together with you today and share infant and early childhood mental health across Ohio systems and take a look at that cross-systems work that Ohio's engaged in. And so I'm Dr. Angie Gibbs. I am with Hopewell Health Centers and project lead on the Ohio Department of Education expansion project. And with me today is Misty Cole. Misty is the Infant and Early Childhood Mental Health Administrator with the Ohio Department of Mental Health and Addiction Services. And we do just want to pause and give special thanks. Our presentation is supported today by funding from the Ohio Department of Mental Health and Addiction Services, the Ohio Department of Education and Workforce, the Ohio Department of Developmental Disabilities, and Hopewell Health Centers. So our appreciation to those systems. So there are two objectives that we would like to accomplish during our time together today. The first is we would like to identify 3 unique ways and benefits of cross-systems or cross-service collaboration. The second is we want to identify 2 ways that IECMH Consultation supports a multi-tiered service framework. So I'm going to pass to Misty, and we're going to begin exploring Ohio IECMHC delivery services and that model. So Misty.
Thank you, Dr. Gibbs. I appreciate your warm welcome to all of our participants. And I wanted to start today by just taking a quick look at the Ohio model of service delivery. You'll see here that we have 4 buckets of work, and we're going to specifically focus on one of these buckets today, and that would be the IECMHC workforce expansion. In Ohio, we've had the opportunity to have our infant and early childhood mental health consultants within our early child care systems, working closely with our CCR&Rs and everyone who's really providing services in the ECE space. But as we talk today, we'll look at ways that has been expanded across various services in Ohio. So we'll spend a little bit more time there in just a moment, and we'll touch on the next 3 spaces just to give an overall picture of what's happening in Ohio. In addition to that workforce expansion, we have our Infant and Early Childhood Mental Health Training Institute. I think this is a really unique part of the work, and of course, one that's near and dear to my heart, as I served on the Training Institute as a master trainer for 10 years. It is a really intensive workforce support, not only supporting infant and early childhood practitioners in our early learning spaces, but also supporting the infant and early childhood mental health consultants across the state of Ohio. There are 10 master trainers currently. They are available in every region of Ohio. They do trainings in person, they do trainings virtually, they develop content in response to needs of the field. And these trainings are offered free and in line with Ohio's Step Up to Quality. They are also Ohio approved, and many offer CEs as well. Moving on to our preschool expulsion prevention partnership, OPEP, the Ohio Preschool Expulsion Prevention Partnership, in collaboration with Nationwide Children's Hospital in Columbus, Ohio. This is viewed as a rapid response service for children who are in danger of suspension or expulsion. So the way this works is a referral is made to Nationwide Children's Hospital, and within 72 hours, one of our consultants responds to that referral and goes out into the system to take a look and do observations, talk with the adults that are part of the child's life, and then begin to offer resources and planning to support that child and to keep them embedded in that early childhood system, which we know is where they're going to get exactly what they need towards kindergarten readiness, social, emotional, behavioral supports, and also utilizing a natural space for them to develop in the context of their peers. And then finally, we have our IECMH statewide program evaluation. And this is really more of an internal piece on our end for quality improvement to ensure that we are meeting outcome metrics, to ensure that we are doing exactly what we need to do with our delivery model, to celebrate the successes and to take a look at the challenges as well. And that is through our partnership with Ohio Guidestone that we do that level of work. So I mentioned that we'll dive into that expansion piece, and that's exactly what we're going to do here. So the first piece that I wanted to kind of bring into the forefront of everyone's mind today is the IECMH and Ohio Department of Developmental Disabilities expansion. We are still in the pilot phase of this piece, but what we've noticed, and I'm sure what many of you have noticed in your states, is that there is a lot of places that infant and early childhood mental health creates a foundation for the services that are already happening. And so not just within our early learning communities, but within child serving agencies, child serving services. And as we began this pilot, we really looked at several goals. The first was to create statewide access, meaning that all 88 of Ohio's counties have access to infant and early childhood mental health consultants in their early intervention programs through the Department of Developmental Disabilities. And when we were looking at how to support and how to offer those supports to the field, to the early intervention field, one of the focuses that we wanted to take a look at was increasing the confidence the developmental specialists who are out there, helping them with resources for mental health, helping them look at the trauma lens. And then, of course, we're doing really robust data collection. And you'll hear that from us frequently as we talk today, because we want to be able to show that the outcomes that we have focused on are really what's needed for children and families. So in order to access your infant and early childhood mental health consultant, they are actually attending early intervention team meetings at least twice monthly in every county in Ohio. And in those meetings, they are sharing information and they're sharing resources. They're talking about additional assessment and screening tools for social emotional development for children. And as mentioned, they're bringing in that trauma-informed lens. Does this child's development have any piece of what has happened to them in their life? And of course, we're often finding that that's the case. We know that trauma impacts development in a number of ways. And then having that early childhood mental health consultant in those spaces provides consistent and regular expertise in mental health for teams and families. And we know across the nation and in Ohio also, that workforce has really struggled over the last few years. And sometimes access isn't as easy as we would like it to be. So this pilot provides that ease of access, that continuity of care, and that regular accessibility. So what are the benefits of this pilot? Well, I've mentioned before that there's an increase in trauma awareness and its impact on development. There's also an increase in competence, not just for the teams, but for parents as well. The IECMH consultant provides that mental health lens to the work. And what we've noticed as we have kind of partnered with various people in Ohio, we all have our areas of expertise, we all have our areas of specialty. And so being able to walk alongside of people who are doing occupational therapy, speech therapy, and add that mental health lens has been really helpful. We also know that people who are doing this work must be well to do it. And the last few years have created a lot of stress for everyone who is supporting children and families. And so not only are the consultants providing support for families and children, but for the staff as well. Some of you may be familiar with Nefertiti Bruce Pointer from the Devereaux Center for Resilient Children. And she says, we all know it takes a village to raise a child, but it also takes a healthy village to raise a healthy child. And so our infant and early childhood mental health consultants are working to help ensure that the workforce is healthy, and so that those in our village can raise children inside of a healthy village. Consultants also support emotional strategies into the individualized family service plan to ensure that those pieces are a focus, that social emotional development does not get left behind, but again, creates a foundation for the additional services that are being offered. So what does the future look like for our partnership with DODD? We are excited, very excited to continue this partnership as we've moved forward. Our infant and early childhood mental health consultants have also become part of the collection and evaluation, assessment and evaluation, and various other pieces that have been identified as needs within early intervention. We're looking at ways to continue strengthening the collaboration, and that involves open, transparent, continual communication, monthly communities of practice where infant and early childhood mental health consultants can get together along with supervisors to share challenges and successes. And we're really gathering those success stories along the way, along with our quantitative data, so that we're able to accurately share the narrative, share what has happened in this partnership, and put in the spotlight the outcomes. We will move on to another partnership. This is our FQHC partnership that we're about to start talking. And FQHC is Federally Qualified Health Center. And I get really excited about this because this has been my dream in the world of infant and early childhood mental health. Because these partnerships are really allowing us at every entry point to put a focus on the mental health of children and their families, and to ensure that they have supports in place. And we know the earlier the better when it comes to mental health supports. So when we began this partnership, the idea was to have federally qualified health center staff trained and receive the ECMH credential. FQHC staff, these acronyms, my goodness. FQHC staff include pediatricians, nurse practitioners, social workers, anyone who would be working inside of primary care. And they have gone through the Georgetown model, our own version, the Ohio model. They have become ECMH credentialed staff members. We worked closely with them for a workflow to be created that incorporated the Devereaux Early Childhood Assessment at all well child checkups. So this is the part I get really excited about. From the time a child is born, we are looking at their mental health in these FQHCs. Every well child checkup, a DECA is being performed. And if there is a space where additional supports are needed, the ECMH credentialed staff member is able to utilize those supports for that family and for that child. So perhaps at 6 months, the ECMH consultant notices through talking with the family, observing the child on that visit, that attachment seems to not be maybe where it should. That consultant will be able to wrap around services to support that family and that child at that point in time to ensure that they're getting exactly what they need. The other piece that I love about this is when we start talking about mental health in context with physical health, we start to destigmatize mental health services for both parents and children. It becomes part of going to the doctor. We check your heart rate, your blood pressure, and we take a look at your mental health and make sure that you're well in that space too. One of the other big pieces for us as we looked at this project was the maternal wellness piece. And so as part of the project, maternal depression screenings are taking place in these FQHCs as well for expecting and new mothers. So again, the earlier the better. We can get supports in there for mothers to ensure that they are on their way to wellness and being the best parent that they can be as their child comes. As I mentioned, the benefits here are mental health screenings and conversations that become a part of each child checkup. The early identification of potential challenges that include the perinatal mood and anxiety disorders, attachment, child initiative, self-regulation, attachment and relationships in general. And having infant and early childhood mental health trained staff inside of those FQHCs also open the door for additional resources, community connections, and support to provide effective services. When we began this project, our goal was to meet every FQHC in the state of Ohio. We're at 58 FQHCs right now. And in year one of our partnership, we were able to meet 23 of those, providing 3 cohorts in the first year of the partnership, taking them through the trainings, the DECA training, the Devereaux Early Childhood Assessment, the Ohio model of infant and early childhood mental health consultation. They took additional Ohio approved trainings to make sure that they had a real focus on infant and early childhood behavioral health. And we have just, I'm so excited to say, signed our contract for year 2 with our goal of meeting the remaining FQHCs, meaning that every FQHC in Ohio will have access to these services, continued supports, quarterly meetings to get their questions answered, We will be providing 2 cohorts in January and February to get those folks trained and to offer them the resources that they need. Our grant has also allowed for Devereaux early childhood assessment kits to be delivered to every FQHC, for the eDECA, the electronic version of the DECA, to be accessible for all of these individuals. We're collecting data to show the impact. How many children are getting DECAs? How many supports are being offered? How many maternal depression screenings are being provided? And how are these services overall impacting the family in the community and their ability to access infant and early childhood mental health supports? With that, I am going to pass it on to Dr. Gibbs, who is the lead for this particular partnership, and she will be sharing with you the amazing things that are happening within our Department of Education partnership. Dr. Gibbs?
Thank you, Misty. Just as Misty said, she gets really excited about the FQHC project. I get extremely excited about this partnership with the Ohio Department of Education. My background is as an early childhood educator, and most recently as part of the state support team, where I was an early learning consultant and then ultimately the director of one of those 16 state support teams in Ohio. So being able to look at the work and come alongside the Ohio Department of Education and the Ohio Department of Mental Health has been exciting. And so we'll share just a little of that with you today. So this actually marks the very beginning of our second year of implementation in our OMOS to ODE SST expansion project. And what this project is really an innovative, it's a cross-systems partnership between ODE and OMOS, where we aim to build the capacity of the Ohio Department of Ed's 16 state support teams across Ohio, and most specifically, their early learning consultants. And what we want to do is offer these services through the provision of early childhood mental health programmatic consultation. So SSTs engaged in systems level work. And so we wanted to come alongside, offer a mental health lens through programmatic and systems level support. So SSTs may be familiar or unfamiliar for many of you, and really just think about state support teams as a bridge between the more than 612 public school districts, career technical centers, community schools, and early learning programs all across Ohio. SSTs collaborate with families and regional partners, and of course ODE, through a continuous improvement process, with their aim, of course, ensuring that each child in Ohio has a quality education. SST consultants are educators with expertise in the Ohio improvement process, early literacy, early learning and school readiness, positive behavior, intervention and supports, and special education. And so with this project, we wanted to, as you've heard Misty say as well, we wanted to come alongside and we wanted to offer a mental health lens. And we have had an exciting opportunity to really build this framework from the ground up. And having come from the state support team side into now this mental health side, and really creating partnership between the two. So as we were building the framework, we looked at 4 primary goals, and you see those here on the screen. Really building a foundation and a framework that has sustainability, that creates and establishes expectations and aligns priorities of the two systems. In doing that, we wanted to ensure that each of the 16 state support teams had a one full-time equivalent consultant who could come alongside, engage in the work, build the capacity of that ELSR or early learning consultant, as well as provide supports to the entire SST team. And so we did this through, as I said, aligning those priorities, creating partnership plans, and really investing alongside those SST teams to not only bring that mental health lens, but also begin to understand the educational system and how the two systems could collaborate. We looked at expanding the capacity of ELSR consultants and teams, and we really have focused that on a lens or through a lens of staff wellness, enhancing the capacity of those team members, creating mental health and community collaboration, and then also looking very closely at what SST priorities are and how we can provide that mental health lens. Within our framework, we also aim to expand the capacity of our early childhood mental health consultants. And we do this in a number of ways. We've built in communities of practice. We meet twice monthly. There's a program manual that guides the work and serves to provide information for both the mental health and educational system as they come together in partnership. Our consultants are engaged in a robust professional development training plan, as well as a very robust orientation and onboarding. And so while our mental health consultants are providing those services full-time to SSTs, they're also deeply engaged in enhancing their own capacity behind the scenes. And then finally, our fourth goal there was around organizing and implementing a local pilot, which we did down here in Southeast Ohio, in SST 16. With that, we looked at a local demonstration project and really investigated and collected data around next steps, looking at where our mental health lens could really be most effective and where those entry points were. So the benefits. So as a result of this work and implementing this framework, early childhood mental health consultants have joined state support teams, and they're working together to support ODE's strategic plan for education and Ohio's Whole Child Framework, which looks at both academics and those social emotional pieces. And our consultants are guided by three primary goals as they go into those SST teams. And the first is to promote staff wellness and self-care, not just for the SST staff, but also for those district partners where SSTs are working. As Misty said earlier, we need healthy adults so that we can ensure healthy children. And so a big piece of our work is around that staff wellness and self-care piece. We want to, secondly, build capacity of the early learning and school readiness consultants and the SST teams in general, so that we can promote those pieces of social emotional learning and the whole child framework in their regions. And we want to be able to partner to help respond to challenges that they encounter in their work as consultants as well. This piece has been really exciting for me as a previous consultant and director to see the way that our mental health consultants can come alongside and learn with and from our SST partners, and then take that learning into the systems through an educational perspective. And the data that we're seeing and the work that's happening has just been extremely exciting to watch unfold and develop. And then finally, our consultants are tasked with the third goal, and that goal is to support regional SST initiatives. So while there are 16 SSTs, each working through a grant agreement and a set of activities as prescribed by ODE. At the same time, the way each of those 16 SSTs engage in the work may look a little different. Different regions have different areas of focus. And so we want our consultants to be able to respond to and work within those areas. So that may be around PBIS, could be through community collaborations, family engagement, and other priorities as determined through needs assessment with our SST teams. So building in some flexibility and independence in the way that consultation happens has really been critical to the success of the work. So what's our future? So we will continue to build capacity of our early childhood mental health consultants and teams, and continue to support that state support team in that space. As Misty said, you will hear this more than once from us today, but we will continue our robust data collection and analysis of that data. We have worked extremely hard to have both qualitative and quantitative pieces to the data that we're collecting. And again, as Misty said, we really want to be able to tell the stories of the work, right? And so we have the data that supports not just what's happening, but also the impact of what's happening, which is really exciting as we get further into the framework. We continue to identify opportunities for sustainability and looking at that through the lens of the data and the stories to tell. Opportunity abounds in this work. And then finally, we want to continue to support the state support team workforce, come alongside, provide that mental health lens, and really build a bridge between the two systems.
Thank you, Dr. Gibbs.
Thank you, Misty.
We have given you a lot of info on 3 really big partnerships here in Ohio in a very short period of time. And so before we begin our reflection, I wanted to give an opportunity to see if any questions had come up for folks that we could answer for you before we move on.
And you can put those in the chat, or if you want to unmute, just raise your hand and we will unmute you.
And John, I agree. Those acronyms are really something else. If there are specific ones that we did not go over, please feel free to pop them in there and we will share.
So, John, thank you. Yes, that's a great question. So the role and function of SSTs. So state support teams in Ohio are a bridge between, they take information from ODE, the message, the work, and they translate that and then work with school districts towards school improvement goals. So these consultants often have areas of expertise. So for example, early literacy, early learning and school readiness. There are consultants who focus primarily on school improvement through a continuous improvement cycle, special education consultants, and positive behavior intervention and supports, or PBIS, another of those acronyms. And so they take those expertise into school systems and really come alongside their school district partners, administrators, superintendents, teachers, really with a lens of, one, sharing information, two, providing consultation, and most ultimately improving outcomes for children and families. So it's a very high-level consultant role that reports both through and to the Ohio Department of Education. Thank you for the question.
Other questions that are standing out at this point? Do not take my moving on as a stop to those questions. If you are typing, we will get to you. But we will go ahead and begin looking at kind of this reflection piece. So as I mentioned when we started, doing infant and early childhood mental health consultation over the last decade, in my case, has shown that it has a place in a lot of systems and throughout a lot of services. And while the most glaringly obvious and what most of us are most familiar with is, of course, supporting early childhood education programs, Head Starts, family childcare providers, we wanted to give just a moment based on some of the information that we've shared with our partnerships with our state support teams, the Department of Education, the Department of Developmental Disabilities, our federally qualified health centers, primary care, pediatric care. We wanted to give just a moment for folks to think about where might be a space in your state within those systems. What is the equivalent where you are? Is there an equivalent? And how might you be able to integrate infant and early childhood mental health into different services? So as you think about that, you are welcome to share in the chat if something hit you that you would like to share with others. And we'll take just a minute or two to allow for that to happen. I am not seeing anyone in the chat box. I'm going to chalk that up to the fact that Dr. Gibbs and I just explained things incredibly well, and your minds are spinning with all of the possibilities. A little pat on the back for us today, Dr. Gibbs.
I'll take it.
Take it on a Monday.
That's right. Absolutely.
But again, don't take my moving forward as a space to not throw those things in the chat box if they come to you. I simply have a difficult time with awkward silence. So, as we've talked about throughout this space, infant and early childhood mental health is really foundational across services. It's foundational across systems. And in Ohio, you may or may not be aware that we are actually moving into a new cabinet level department. It is called the Department of Children and Youth. And various pieces of legacy agencies will be moving into that department, serving children birth through age 21. Infant and early childhood mental health will be moving into that new department. Time frame looks like January. So this will no longer be supported and held in the Department of Mental Health and Addiction Services. Infant and early childhood mental health consultation will move into the Department of Children and Youth. And the idea is to eradicate duplication of services, to ensure that families are able to navigate systems that serve them and their children more readily in the state of Ohio. And my personal goal in this work is to find space across all of these different services. The Department of Health, which will have a part in the new department, as well as DODD, Department of Developmental Disabilities, Children's Services, Department of Job and Family Services, our child care licensing and policy. We want everyone to see this as a foundational service that is necessary in each of those services that are being offered to children and families across the state. And so as we make that move, stay tuned. We are looking forward to finding additional spaces to expand, additional spaces where we can meet needs. And we know that the return on investment is significant. For every dollar we spend now on children's mental health in the early years, there's a return of up to $3.47 later in life on services that are not needed. So we want to be able to ensure that we are seeing that return on investment, that we are intervening early and often, and that we're getting there with the right type of care when it's needed, the right resources and supports, and that our overarching goal is to also create a healthy workforce where self-care is a priority, where we have healthy individuals providing services to build healthy communities. So we wanted to make sure that we kind of went back to our objectives that we came to you with as we started our presentation. And the first we asked as an objective was that you would be able to identify benefits of cross-systems collaboration. And so I just wanted to take us back a little bit and say that whole child focused services, whole family services are at the forefront of this work. That removing silos and instead of seeing everything as an individual service that's provided, we see mental health as a foundation of those services that are being provided. We eliminate those silos and work together towards positive outcomes for children and infant mental health. And that we also look at removing stigma associated with mental health. That mental health is just a part of checkups, just as your physical health is. And looking at that physical health piece, blood pressure, weight, mental health, attachment, relationships, initiative, self-regulation, maternal wellness. And I think that when you put that picture together, it becomes a very exciting place to be in the world of infant and early childhood mental health now. And I'm going to pass it to Dr. Gibbs for the second of these objectives we set out to talk about today.
Thank
Dr.
you,
Gibbs.
So let's take it back and think about how early childhood mental health consultation supports multi-tiered services. And again, I get excited about the potential in this work and in thinking through those multi-tiered systems. And when we begin to tie ECMH services and consultation to that framework across different sectors, right? We've talked about many of those today. It allows us for implementation of services, connection of resources, and more robust support at a universal tier 1 level, at an targeted tier 2 level, and at a tier 3 or more intensive level. And so we really see the ability to create systems that are providing clearer and more efficient entry points, and then able to best meet the needs of that system. And finally, we're always looking towards building capacity, enhancing connections, and promoting collaboration through these partnerships. And in so doing, we're ultimately able to best support the adults who are supporting children and families. And so always at the core of everything we're doing, our conversations always come back to how are we going to impact children and families to the fullest and best extent, and ensure that they're receiving the benefits of the work of these partnerships as well.
Thank you. And we would like to thank each of you. I did mention that our contact information is here. If you leave this presentation and are hit with lots and lots and lots of questions that you really wish you would ask during our session, this is not the end. You are welcome to reach out to Dr. Gibbs or myself. You will see that my email address has changed, so it is not Mental Health and Addiction Services. It is under that new umbrella for the Department of Children and Youth. And we would be happy to answer any questions or share any of our experiences if that would be helpful for you all. And of course, our resources with the partners that we are lucky enough to work with often. And if there are any pressing questions, we have just a couple of minutes left. We're happy to take those.
Again, you can put your questions in the chat or feel free to raise your hand. We can unmute you. I'm not seeing any hands raised. I'm going to give everyone just a minute though. I actually had a quick question. Well, maybe not a quick question. I heard you you mentioned a figure around return on investment. How did you come up with that number?
I came up with that number by looking at my partners and their amazing research. So that actually comes from 0 to 3.
Okay.
0 to 3 has done extensive research on that return on investment piece. And it's often one of the largest questions that I get asked with our state partners is where is the value in this and how can we show that value?
Yep.
So I try to bring it up every chance I get because it really is one of those things that people want to know.
Yeah. Yep. Same thing at the Center of Excellence. Constantly being asked that very, very, very good question. And yeah, very grateful we have great research of partners. And I know, at a very specific level, everyone wants to know that question as well in different systems. And it's so hard to get that number. So I was curious.
They have some beautiful infographics that go along with it, Lauren.
Mm-hmm.
So for anyone who is hearing those questions, check out 0 to 3. They do have some beautiful pieces that I've been lucky enough to be able to use in all of the advocacy that's happening in Ohio.
Ohio has been a good friend to the COE for as long as we've been around, and we are always learning from you all.
Well, we appreciate it too, and we are certainly always learning from all of you.
Awesome. I see we have 1 minute to go, but I won't hold everyone just for sake of that 1 minute. Thank you very, very much to our presenters. Thank you all for attending. Keisha, thank you for being our tech host. And I hope everyone has a great final session of the day, and we will see you all back tomorrow. Thank you all very, very much.
Thank you.
Thank you, Lauren.